Welcome, everyone. My name is Mark Hoosein, and I am the CEO here at the Alberta Construction Safety Association. Before we get started, please note that this webinar is being recorded and will be available to watch on YouTube within the next 2 days. We're using Slido to manage questions today. The Slido link is in the Zoom chat and in the live stream description if you're joining us on YouTube or LinkedIn. Head over to slido.com and enter the code PHS Webinar 3, all one word, and that 3 is a numeral, not spelled out. PHS Webinar 3. Once you join Slido, you'll see a few short questions. Please answer these as we get started. You can also ask your questions or vote on others' questions. Questions will be moderated and we'll tackle them after our conversation. So before we begin today's conversation, I first want to set some context for those of you who may be joining us for the first time. This is the third and final webinar in our three-part series on understanding psychological health and safety in Alberta's construction industry. We started this conversation at last year's conference, recognizing that our industry faces unique challenges. According to the Government of Canada, men in trades experience the highest rates of substance abuse and addiction, which is exacerbated by factors inherent to our industry. These factors contribute to confusion and uncertainties, particularly on the employer's role in creating psychological, healthy, and safe workplaces. ACSA's role in supporting psychological health and safety in Alberta construction is to bring in industry partners such as OHS or Alberta OHS, the WCB, to facilitate understanding, legislative compliance, and safety and business excellence. At our first webinar, we hosted Alberta OHS to help us understand psychological health and safety and discuss the types of psychosocial hazards and how they might look in our industry. We talked about environmental factors, organizational factors, and personal factors. This webinar helped to clarify the term mental health as the outcome of psychological health and safety. At our second webinar, we hosted WCB Alberta to discuss psychological injuries in our industry and how employers and teams can support those returning to work after a psychological injury. We noted that more than half of all psychological injury claims are workers in the first year at a company, which is also what we're seeing for physical injuries. A psychological injury can be the main injury or a secondary injury that follows a physical injury. If you missed these webinars, you can watch the recordings on our YouTube channel. Now, this webinar aims to bridge the gap between the roles of employers and employees in creating psychologically healthy and safe workplaces. We'll address practical ways for preventing harm and promoting well-being at work. We know that both employers and employees have important roles to play in keeping our workplaces both physically and psychologically healthy and safe. So today, we welcome Tiana Field-Ridley from Opening Minds, which is a division of the Mental Health Commission of Canada. Tiana co-led our 2023 conference breakout session on preventing burnout. So welcome, Tiana. And can I ask you to start us off by telling us about your role and how it relates to psychological health and safety?
Hello, thank you so much for having me. I am the Senior Development Manager for PHS at Opening Minds. Now, what is Opening Minds? So Opening Minds is a not-for-profit social enterprise, and it's a division of the Mental Health Commission of Canada. So you might be more familiar with the Mental Health Commission of Canada. What we are, the Mental Health Commission of Canada was founded as a research entity to support mental health within Canada. So MHCC, as we call it very often, is also a not-for-profit, but funded by Health Canada. And we have the Opening Minds division, which is what we're a part of. So the Opening Mind divisions is a social enterprise, and our focus is on making sure that we're making that impact and social contributions as its primary focus of business. So Opening Minds division is not funded by Health Canada. Instead, we make our nonprofit revenue from training programs, assessment programs, services, everything to do with psychological health and safety. Personally, what do I do for Opening Minds? So I guess I am the PHS go-to person. So we develop and build programs to help to implement psychological health and safety and improve overall systems for psychological health and safety. So we develop training programs. We have a psychological health and safety assessment program that we've just launched. And we work with employers in many different ways to try and help to support whatever implementation of psychological health and safety we can. So whether it's through those services, through training, or sometimes just questions on getting the right direction on where to go and how to help with implementation, we're here to help with that. We also collaborate with a lot of different organizations. So ACSA, many different organizations across the country. We're a national organization. We try to collaborate with as many as we can so that we're not just building programs, for you, we're building programs with you as organizations to meet a lot of the needs of the different industries across the country.
Okay, thank you. So I think just before we get into it a little bit more, can you clarify for the folks in the audience here the history of the Mental Health Commission of Canada? Like, how did it come to be? Why was it established? Can you give us some background there?
Yeah, for sure. So it was established in 2007 to help improve the mental health needs of Canadians. So it's a nonprofit organization, and MHCC is more in charge of conducting research. We have certain mandates from Health Canada, and we make sure that that research is supporting the wellness and well-being of Canadians across the country. And then, as I said, Opening Minds is separate. So very similar mandate in terms of making sure that we are meeting the needs of Canadians, but just a bit more focused on services and impact and training. So that's just a little bit of a difference between the two organizations. We're sister companies. We're just recently going through some internal changes.
Okay. Well, I guess my first question, like in our first webinar with Alberta Occupational Health and Safety, we talked about the types of psychosocial hazards in the workplace. And Alberta OH&S grouped these psychosocial hazards into 3 categories: environmental factors like lighting, air quality, noise that could affect us both physically and mentally; work organizational factors like shift work, workload, job security, and a lack of control over a job; and then personal factors that are outside of the employer's control, but impact a worker's ability to perform their tasks safely, such as physical health, work-life conflict, pre-existing conditions like depression and anxiety. The simplicity of these 3 categories helps us understand the types of psychosocial hazards. That said, the national standard for psychological health and safety in the workplace uses 13 factors. Can you describe the intent behind these factors and maybe walk us through them?
Sure, for sure. So those 13 factors, let me just start with talking about the national standard first. So the national standard for psychological health and safety is essentially designed as a management system, and it's a voluntary standard that was established 13 years ago, I think, and they really designed it to try and support psychological health and safety in the workplace. So one of the portions and one of the parts of that national standard is identifying these 13 psychosocial risk factors. And they really relate to how things that we can identify with at work. So, workload management, civility and respect, psychological harm. And there's other factors related to different industries as well. But these 13 factors act in a very similar way to how OHS risk factors work. So they're managed by a risk assessment process. You have different risk assessment programs that you put in place to manage those factors. However, if we look at psychosocial factors as a whole, the risk management system and process is just one part of what psychological health and safety management systems look like. So what I mean by that is when the standard was created, we needed to socialize it in a certain way. And it was socialized in a really great way to talk about those relatable factors. But I think along the way, there was a little bit missed, and it actually builds into a stronger management system together. So what we need to make sure is that we have that whole management system in place that is supporting that risk assessment and that risk assessment process. So we need to make sure that we're focusing on things like commitment, participation, implementation, review of those things. So very similar to how the OHS Act is and how we manage OHS generally in the workplace, it's very similar to how we manage PHS in the workplace. So making sure that those risk factors are included and supported. So we kind of have an analogy that we thought is great for not only this industry, but generally, is that think of managing those risk factors as those tools that you need to build something or build a house, for example. You can do all of that and you can build things, but without having that PHS system as a blueprint, you don't really know how to continue to build it, and you don't have that overall plan. Think of PHS as that overall blueprint, and those risk factors are one of the parts of it. We want to make sure that we're managing everything as a whole and that we're building it together and not just in separate programs.
Yeah, you know, the bones of it sounds so similar to the core program that we're a champion of, that you have the right systems in place and it covers the risk factors that you deal with. So I mean, it just really resonates with me and a lot of the work that we do here at the ACSA. So just can we talk a little bit about the employer's role in creating psychologically health and safety workspaces or workplaces? Many conversations are happening right now on psychological health and safety and employee mental health. So this is good, but there's also a lot of confusion and uncertainty specifically on what the employer has control and influence over. So I'm hoping you can help us understand the employer's role a little bit better in preventing harm and promoting workplace well-being.
For sure. So legislation has started to come in a bit more and what that looks like in the different provinces. And I think you guys talked about it in your webinars before as well. But it's taking a little bit more of having more responsibility for protecting and preventing psychological harm. So the employer's role is becoming more and more, what can we put in place to help and be more proactive and stop things from happening, or put preventative barriers in place in order to try to deal with some of the things as they arise instead of responding to them after they happen. So that's more of where the employer's perspective comes from. So we want to make sure that we are, looking at how, for example, bullying and civility are dealt with efficiently, that workloads are manageable, and that they're not causing unnecessary stress in the way that we're doing work. We think about the employer's role as a way to identify, assess, and manage those risks, but also to ensure that employees are trained and knowledgeable about psychological health and safety, about psychological injury, how we can protect each other. So there's a big role in providing that training, having that training available, having those resources available, but also having the processes and procedures in place to support that. So we want to make sure that we're building that system, like we just talked about, in a much larger way, so that it's not just, like I said, responding, but how do we prevent it from happening in the first place? Of course, everything is within reason. We don't expect, everything is not within an employer's control. We need to make sure, though, that we're setting up the right environment, taking more of that proactive approach, and that can help to prevent some of that from even occurring in the first place. So we want to make sure that when we're evaluating those risks, we're also thinking about the certain roles that are at higher risk of experiencing those hazards or are more vulnerable to experience those hazards, and think about how we can prevent that from happening. So for example, one of the things, for example, is a road construction worker who is on their own, they're laying out cones while, people are going by, speeding past them, or they're angry because things are delayed. Here we are in Edmonton, we know what that means. And you might, one of the ways that you can mitigate that hazard, for example, is by scheduling that cone laying for when traffic is lighter, or when, having a different way and different time for doing that, so that you're not exposing them to that type of hazard that they would get from commuters yelling at them and being angry. Another thing, for example, would be having clear leadership and expectations. So it talks about how your roles are better defined and explained, so that it lessens any confusion as to what you're supposed to be doing on site. So you could be more accountable to that role, and you're not thinking about 10 different roles at the same time. You're thinking about how you can make sure that you're focusing on what you have to do. You're not distracted by that, because those kind of distractions can lead to incidents, and that clarity in roles sometimes helps to make things a lot easier. So if you think about those factors, there's lots of different areas that they apply. I can tell you also that I sat on the WCB Appeals Board for quite some time as an appeals commissioner, and I adjudicated lots of cases. And a lot of the cases that we're seeing recently is a lot about psychological injuries. And a lot of it, when we were adjudicating those cases, was more looking at how the employers took preventative measures. That's really where that employer perspective comes in. What are we doing to prevent it from happening in the first place? Without that, having that layer, it makes it challenging to know what everybody's role is within trying to manage psychological health and safety.
Well, it goes back to kind of what you said earlier, is if you can build the right system, the right management system, you can account for these things, like a penny of prevention is worth a pound of cure on the back end. So getting the right system in place just makes everyone's life a little bit easier, I would imagine.
And I'm just going to add in here, and I know this is off script, but a lot of it is how we do work. When we think about psychological health and safety, it's about how we do work every day. It's about preventing mental health issues from occurring. It's about helping people with mental health, but that's what this whole system means when we talk about psychological health and safety. It's going to work every day and thinking how we behave, how we act towards each other, what we do. And we'll talk about that in the next question, but I just had to put that out there.
No, it's good. And I mean, to that point, what are some examples that you can share that are examples of successful strategies or programs
For sure.
that some employers have implemented to prevent the exact psychological harm at work? Or, I mean, we're the Alberta Construction Safety Association. So do you have any that specifically target construction employers that help with that system, that help with that prevention?
So a big number one for us right now is making sure that there's a big focus in training. I think training is the number one way of how we start to educate people to know what some of those risks are, because knowing is everything at the end of it. You don't even know if you're causing psychological harm without understanding what some of those factors are that would cause psychological harm. So training is a big part of that. Knowing the expectations of individuals and employers can help to shine that light on how we need to reduce that harmful behavior. Another successful part of that is also training leadership and training and equipping them with the right tools like conflict management strategies, or knowing how to deal with processes and procedures when they come up, how to handle mental health crises. What do we do, if psychological health and safety is, and understanding what it is in a bigger perspective, and how do we deal with the incidents as they come out? So, one of the things that we always do as leaders is say, go talk to your manager. If something comes up, go talk to your manager. But if we're not equipping our managers with the right ways and strategies of doing that, and that's all the big part of training and practicing and using those kind of tools and strategies that we have within the workplace to support it. We want to make sure that they know their role, they know the psychosocial hazards, and then they can help to support their teams. So, giving that everyday support, whether it's through resources, having resources available, making sure that there's different outputs, and then also looking at those psychosocial hazards again and saying, how do I support my team with workload? How do I implement this process in a way that's going to work for my team? Because everybody's different. So, yeah, I think it's just a matter of eliminating that psychological stress and really helping with managers to make sure that they are prepared for what's coming down the line as well.
So I want to go back to what we were talking about earlier, some successful strategies that employers have implemented to prevent psychological harm. I think we may have missed that question. You and I had a good conversation about it, but we may have missed that in the webinar. So, I'm an employer. I have a team. What can I do specifically to prevent psychological harm at work as an employer?
And apologies if everybody actually still heard this, so I'll just repeat a little bit what it is, maybe emphasize a little bit more. But training is one of the biggest pieces that we want to do as those strategies and programs that we're trying to implement within an organization, because training is really going to be our knowledge base for everything that we know, because you can't help something that you don't know. So knowing those expectations of individuals and employers can help to shine that light on how we need to reduce those harmful behaviors that happen. So we want to make sure that we're training, not only the staff, by all means, all employees. We want to make sure that we're also training our managers and our leadership teams to make sure that they know what their right tools are. How do they deal with conflict? How do they develop processes? How do they develop procedures? How do they handle a mental health crisis? Because we're always quick to say, go to your managers, go to your supervisors when you have extra questions, but we need to prepare them for what that looks like. So huge part of it is training. A huge part of it is training and understanding what psychological health and safety is, and preparing those managers is another piece of it. And then also those managers can then in turn say, well, now what do I do to support my team? How do I look at those programs to say, what do we have in place for workload management? What are we doing, if a project coordinator has multiple projects and they are having trouble managing their deadlines? How can we resource them to help to eliminate the psychological stress that's causing for them? So giving those kind of tools and preparing them in those ways it will have huge impact at the end of the day.
And even part of that training is situational awareness, right? It's just noticing those things about the people that report to you that, when they're struggling, when they are acting differently, about maybe when it's time for you to just ask some questions about how things are going. So, safety is a shared responsibility. It's a shared responsibility of the workplace. So can we talk a little bit now about employees? If you're a worker, how do you contribute to psychologically health and safe workplaces?
Yeah. So as I answer that, I just want to make a little bit of a difference between psychological health and safety and mental health at work, because I think sometimes we mix the two up. And what we're trying to do is say that they're very different things. And we have training programs to identify this and go more in depth. But usually when we think about psychological health and safety, it automatically just comes straight to, mental health at work, somebody having a mental health crisis, somebody having a mental health problem. But that's not always what it is at all. In fact, what it more is how, like I said, we deal with work, how we behave at work, how we develop processes, how we are actually doing work every day. So I wanted to just make that comparison as I answer that question on what an employee's responsibility is. Because usually when I say that, I get a lot of questions of, well, what am I supposed to do? I don't want to reveal any kind of mental health thing that's happening. But that's not all there is to psychological health and safety. Some of it is just making sure that our workplace and our environment is also healthy and safe. So just like how we would for physical safety, you wouldn't go and throw a hammer at someone. The same way, you won't go and yell at someone. You won't make sure that you are bringing in, different ways um, of affecting someone's mental health at work and their psychological safety at work. So we need to recognize and identify how workloads, for example, and stress and mental health conditions influence or impact their work. How they ensure that they maintain professionalism by treating each other and themselves with civility and respect on workplaces. You don't want to be hurling inappropriate things because you don't know what that impact will look like to somebody else. I've seen lots of times, and perhaps you have as well, where somebody was unkind or yelled at someone. We don't know what that person is going through. We don't know how that kind of behavior affects somebody in the long run of things and the psychological impact that has. So my point is that employees must be also mindful about their negative actions, how they perceive it, how they act, and then think about that from that kind of lens in everything that they do. How are you interacting with each other regularly at work? Is it respectful? Are you making sure that your role is clarified within the workplace? Are you, telling your supervisor when you might have too much of a workload? Is that something that you're talking about? Are there ways that you want to develop yourself as a leader that you want to reach out for and say, I'd like to be considered for this opportunity. How can I do that? What do I need to get to another stage? There's so many different aspects of PHS that comes around what that looks like in the workplace. And I think it's the employee's responsibility to take a look at that and understand what some of those factors could look like.
That's fair. I've, personally been a part of workplaces where there was not that decorum. And it does have an effect. It absolutely does. So I totally agree with that. And I appreciate you clarifying that for us. So can I ask you, what are some common signs of psychological distress in employees? And how can supervisors and team members recognize and respond to these signs?
This was a difficult question because I was prepared with questions in advance, so I got to cheat a little bit. But one of the things that I wanted to point out is that there are so many amazing courses that we have out there right now. You know, not Opening Minds has amazing courses, and there's all these great courses that really get into the real depth of what mental health distress looks like in employees. It talks more about, you know, how to recognize and respond to certain signs. It goes into depth with what those concerns are. So it's not a simple answer. We have, you know, mental health first aid that goes into depth and the working mind that goes into depth. So I strongly recommend training this for all areas of site, just the same way we do for physical first aid. So physical first aid talks about, you know, how you get somebody from crisis A to crisis B and get them to the right resources. Mental health first aid is exactly the same. It's really recognizing those signs and symptoms and making sure we're getting somebody from one point to another. So one of the big advocacy pieces that we have is to try to make sure that you have people that are trained on every site to have mental health first aid as well. Because the same way we would have any kind of physical crisis, we could have a mental health crisis at the same time. So that's one of the big things that we really encourage education to be in. But generally, we want to ensure that we're open and mindful of how we respond to each other, how we talk to each other. And then we need to be able to ask those tough questions. So not just, you know, I don't want to pry, I don't want to get into it. Somebody might be looking agitated or angry, or they might be completely withdrawn. And it's about finding those pieces and saying, hey, you know, I can still ask questions. I don't need to pry, but I can say I'm here. I can help if there's anything I can do, and addressing it and not just walking away from it. So that's another big piece of trying to help others. You know, you want to ensure that you're giving them adequate time off as well. So if you see somebody that might be struggling or there's a behavior change, talk to them about how you can help to reduce that stress. Is there a way you can reallocate tasks? Or are there other ways that you can refer them to resources that might help? So here's an actionable example. If you notice that someone suddenly has a really strong change in behavior, like they've withdrawn, they're paranoid, they're angry, and they're about to begin a very high-risk task, a coworker could easily pull them aside, check if they're okay, and suggest a break. Or a supervisor can reassign the task to another trained worker or delay it until the next shift. But you'd have to be aware of what those signs look like. So so going back to, and I don't mean to harp on it, but training is a big piece of it. And that's what we created these training programs for, and the importance of making sure that we have these ways of identifying and responding to these kind of things.
You know, like I hear you. I mean, I think one of the things in the future would be, just like we have physical first aiders in every workplace, a mental health first aider is something that kind of is the next evolution. But I would say, you know, for the construction industry, one of the advantages we have is that we have to work in community. You cannot do this job from behind a laptop alone. And so you work with people, you work in teams, everybody, there's camaraderie. And if you can use that advantage more effectively, I think hopefully we can achieve a lot of the things that you're talking about here today. So can we talk about burnout? You're presented at our conference last year on the topic of burnout. How does burnout fit into this conversation about psychological health and safety? And what do you see and hear about burnout? What advice do you have for employers and employees? Because it is a topic du jour for sure.
Yes, and burnout is still equally as prevalent as it was, and maybe even more as it continues to go. There's no shortage of work, that's for sure, and especially in the construction industry. I think we hear year after year that we're always looking for people. We really need good people on sites. Everybody's always understaffed, overstressed, and all of that are things that contribute to what, you know, burnout looks like. And burnout isn't just, you know, being tired at work. Burnout is also a series of symptoms that are related to stress and how they impact the way that work is done. So what we need to make sure is that we're trying to handle a lot of the factors that contribute to burnout. So whether it's that exhaustion, the stress of the amount of work that needs to be done, or personal factors that are all playing into this, cost of living and all these different areas. They really contribute to how a person experiences and what they go through and the anxiety and sometimes even depression that comes from what that looks like. So we want to continue that we want to make sure that we're acknowledging that we can't do it all the time. Like we can't physically do it all the time, even though we think we can. So we need to make sure that we're taking some responsible and reasonable time off, time away from tasks. Sometimes a change in pace or sometimes a change in job roles or job duties can help to prevent some of it from continuing. Sometimes you need to have a refocus and take a look in other directions, but also being aware of those signs and symptoms that come with it. So if you know that you're agitated, you know that you're tired, you know that you're not sleeping at night, these are all big pieces to continue to look at to say, how do I monitor how I'm feeling and how do I change the things that I'm doing around me? And like I said, sometimes it does mean that I need to take a walk away from work. One of the things I hear whenever I talk about burnout is that how can I do this as a small business? That doesn't, I have all of my hours are spent on working. If I don't work, then my business is going to fail. So one of the good examples that I thought that I wanted to bring forward to you guys was to talk about from the lens of a small business and how they decided to deal with some of what was happening. So there was a small business that we were working with, and they had everybody doing everything. So you had, all the different roles. Everybody was doing HR. Half the people were doing payroll. Some of them were doing equipment, looking after the equipment. Some of them were doing the services, and everybody kind of had their hand in all the different pots. And it was getting so overwhelming because everybody was stretched very thinly in how they were doing the work. So one of the things that we said was, why don't you take a look and reallocate those tasks, like align the different strengths with the strengths of people with the tasks at hand. So instead of being in charge of 10 different things, you can be in charge of 2 things and do them super well. So kind of like that whole saying of the jack of all trades and the master of none, a very similar situation. Being accountable, putting more role clarity into what's happening. So you know that you're in charge of payroll, you do HR stuff. You're in charge of equipment, do equipment and do it right and do it well. And a lot of that accountability and that specific task helps to relieve some of the stress of worrying about all the different pieces all the time and having them all at once. So another idea is to, schedule training, for example, in off-peak times, not in your busy season. Nobody gets trained in the summer. Try and plan ahead and be more strategic in how you think about when you should be training people, what you should be training them on, and getting ready for the next season. There's always a fear of, well, we don't know if we're going to have the business next season. But, things are still going on and we still need to prepare for that because it becomes the most stressful when we arrive in the beginning of the season. And every year the season is moving up and up, it feels like. We arrive in the season and all of a sudden we don't have enough workers, we haven't prepared, we don't have trained people, and there's a scramble to get people, and that causes so much stress in the industry. So how can we start to plan ahead a bit more, get more pieces in place, and be a little bit more strategic at times of how we're organizing some of that work? And then while you're doing that, you're thinking as well, that's all part of what psychological health and safety looks like. It's how we do those small things every day, checking in with each other, being aware of those signs and symptoms, having processes in place. And that's something else you can do in off-peak season is build some of those processes in place. Don't expect yourself to build processes while all your crews are out. Do it while you have those slower times and that you can fit it into some more of what you're doing. And then having resources, for example, is another easy win. Having them visibly ready and available are some of the easy ways to start to streamline some of those things that are happening.
So what resonates with me a little bit here is good fences make good neighbors sometimes. And so having really structured roles can help with that kind of burnout, the bleed, and scope creep, as you will. But also, I think even for our industry, knowing what to say no to is just as important as knowing what to say yes. You could bid every single job and then you stretch yourself completely thin over the course of the summertime. And knowing what your capacity is really important from an organizational standpoint.
For sure. For capacity as an organization, I'm just going to also touch on that, but as an individual as well, the same way that we would not, take on an unsafe task at work because we know what our safety boundaries are. The same way we shouldn't, put undue stress onto ourselves because it has these long-lasting impacts too.
So But you know, we're at work. I'm going to take a contrary position here a little bit. Not that I disagree, but we're at work. We've got to get work done. We've got to get projects completed, money in the bank, all of that kind of stuff. So, you know, how can I, as an organization, balance productivity and performance pressures with employee mental health? Are those things always at odds with each other, or what were your recommendations here?
I don't think they're always at odds. There'll always be that balance, just like how we talk about work-life balance. So there's all these different balances that we're expected to have. But I think what we need to look at when we think about productivity and performance is that productivity really won't even happen if we're not performing in a realistic way. So it's not going to happen either way. If we're not having that balance. So if you have somebody that's mental health, somebody whose mental health is poor, productivity and performance will suffer. And I can't be productive if I'm exhausted and overwhelmed. I'm not going to perform like I need to on site. I won't get, be able to focus on my projects. I won't be able to take a look at and get good results from the projects that I'm working on if I don't have that good mental health. So what we want to do is adopt more effective and preventative measures by treating mental health with the same importance as physical health and finding ways to convey that message that we want to do the work and we want to do it well. And we just won't. We won't have the people, we won't have that productivity if we're not thinking along those lines. So, when you think about a broken leg and how that reduces productivity and performance, depression can also hinder and the focus in the exact same way. And if somebody's operating machinery, for example, and they can't concentrate due to things that are happening within their lives, or they didn't sleep well last night, the consequences of that can be fatal. So it's a very, very similar way. We can, say, yes, we need to make the money, but it goes back to even what you said there. We need to make sure what our capacity is, be realistic about our capacity, and design things around that way and design things how we are actually working.
Well, it just strikes me as we are in a labor crisis here in the industry. And one of the ways to help resolve some of the issues is helping people that work for you stay at work, and this is one of those tools. So at our conference last year, I think I'm pretty proud that I saw that our construction industry is poised and eager to address psychological health and safety. So help us get started. What advice do you have for owners of small construction companies, health and safety reps in larger companies, and also supervisors and workers who want to improve things for their teams?
So I don't know if I mentioned this before, but training is important. So again, just back onto that, making sure that training is on everyone's radar. Training specifically in psychological health and safety, as well as mental health and what that looks like. But and hopefully a lot of the small businesses have started to look into things like mental health training and and PHS training, and we have courses that we've recently launched to look and see what that looks like. But that's a big part of for this, especially for the small businesses, of what that can look like. I mentioned, reorganizing some of the roles, assessing some of the needs of the organization. We've launched a large assessment program right now, and it's focused on psychological health and safety and what that looks like in the workplace. And I'll talk a little bit about that after. But we're also in the process of launching a smaller version of that as well to help with small and medium organizations to see what their gaps are, to see what their areas of strength are, and to start looking at ways that we can identify, what policies they have in place, what processes they have in place, and see if they need, different areas of help or implementation. So we want to make sure that we're looking at things like our policies, our processes for reporting PHS incidents. I think, yeah, it's mostly about making sure that you can make those small steps. So you don't need to implement large things, but, doing things like your fit for duty checks or, introducing mental health topics during safety talks are all steps in the right direction. Having that big shift to see psychological health and safety as not just mental health in the workplace, but more of how we do work every day. That's a lot of what we can do to help generally in the area.
Okay. So for my last question here, I want to focus on the resources that the Mental Health Commission of Canada has developed. There are many resources for employers and employees. Can you walk us through some of these?
Sure. I'll give you a couple, and everything that I'm talking about is on our website as well. So we have a lot of free guides and free resources. So we have one that's suicide prevention for organizations that talks about different ways that you can talk about suicide in the workplace. And that's a big topic of discussion. That's a free guide on Opening Minds website. We also have building mental health into operations, another large guide, which helps to talk about how you actually build that into your processes. Bigger things that we have too are the working mind training, our mental health first aid training, and now we have psychological health and safety training and an assessment program that goes along with that. So that just actually launched yesterday officially into the public. So we're quite excited to talk about that, but it really helps organizations to see where they need to be. It talks about what psychological health and safety looks like in a bigger spectrum of things, but also how we integrate it. How do we put it into our everyday processes? And then how do we assess it and monitor it so that it's not just a program that we're looking at, but it's an overall system that we continue to look at all the time. And we don't need to keep reinventing the wheel all the time, essentially. So most of the resources, some of them are paid resources, some of them are free resources, but they are all available on our Opening Minds website. And we're more than happy as well to talk with you individually. So, you can reach out to me. You can reach out to me on LinkedIn, and we can also I can give you my contact. I don't know how we're sending out resources. I think we're sending it out after. But however we send out the resources, I'm happy as well for you to have our contact and to talk to us about all the different things that we have. And we're also developing an additional advisory services program to help to get some of the small organizations on board with how they even start things.
Okay, well, we'll share all of the links to the resources you mentioned on our website, ACSA's website, and in the email that our attendees get when we send the recording of the webinar. But before we get to some of the questions from our attendees, just wondering if you have any final comments or anything you'd like to leave us with.
I do. I just want to say that I think it's a very exciting time, being at ACSA conference last year and seeing the overwhelming reception, but also just an exciting time to see how the construction industry in particular can take a lead in psychological health and safety. It really is the industry is poised so well because you're so familiar with OH&S, you understand a lot of the concepts and you're familiar with safety and prevention. Adding psychological health and safety into that and changing the way that we work is a big part of how we can continue to lead the industry across the country. So while I think that sometimes it might feel overwhelming, there's lots of ways, there's lots of organizations out there to help with these processes, whether it's through ACSA, they're a prime example of the great work. And Opening Minds is here to support however we can. CMHA is always there as well. There's all these different places that we can look at to get those processes started and to provide some of that guidance. And that's what we're here for.
All right. Well, we have a bunch of questions in the chat that I'd like to turn our attention to. If you haven't already, go to slido.com and enter PHS Webinar 3, all one word. If you have any questions that you haven't been posed or they are not posed currently, I'll look to the Slido now. The first question is one that I think is really important. It's how can business owners make it more comfortable for people to speak up?
Oh, for people to speak up. That's a great question. Business owners can set that environment it's a psychologically safe environment is essentially what it is. And it's a way of how you make sure that people feel comfortable making mistakes, but also being able to come to you to talk about things and know that there's not those repercussions and consequences for doing that. A lot of that is setting the example and being vulnerable yourself as leaders. As business owners, making, you don't need to pour your heart out and tell them every detail of your life, but showing them that you too understand, you experience things, you share things with them, opens that environment for them to feel the same way. And making sure that you're setting that example that when somebody does come to you, there's no repercussions for that and consequences, and their job isn't affected by them coming to you. So a lot of it is setting that safe environment up for them.
Yeah, I agree with you. I think, we have to change the mentality about there being good news and bad news and just information that we need to deal with. And so that people can feel free to discuss with you. You bring your whole self to work. Even though I show up on site and I'm an electrician, I'm still husband, father, son, daughter, whatever, and all of the things that go along with that, I bring with me as well. So I just think that acknowledgement and treating people with the empathy to say, what's happening, it really is really, you have to lead it. If you're the owner, you have to lead it. I totally agree with that. So the next one is topic du jour as well. And so how does workplace bullying fit into this topic? It is a big problem on a lot of work sites. So can you tell us a little bit about that?
I think that's one of the areas that the legislation is actually a lot more directional in, I would say. Workplace bullying is unacceptable. There's a lot of areas and processes and employment standards and human rights areas that are actually looking at what that looks like. So the consequences for doing that are becoming stronger and stronger all the time. So if we're not educating and we're not making sure that people even know what that bullying even looks like, you can see how it can escalate. So we need to be educating on a regular basis in different ways, not just training, like I've been preaching, but how do we, even in our safety talks, are we talking about what bullying is? Do we know what it looks like? And you can't just say, oh, it's just the way I speak. No, it's not just the way you speak, it's the consequences of what you said and how that looks. So some of that needs to be looked at a little closer. And it's also equipping your supervisors to make sure that they are equipped when there is incidents happening of how you help that bullying to help to reduce it. But I mean, like I said, those are where a lot of the consequences are coming in. So we have to start being really careful about how we're speaking and how we're acting.
So how can we deal with the privacy issue if an employee hasn't shared they have a mental health challenge? Um, how does that get dealt with on the work site?
So it's the same thing as if you have a physical injury, you don't have to do something. You're not necessarily, you don't need to know what that medical condition is. Sometimes you address just the behaviors associated with it. So if you see somebody that's angry, withdrawn, there is a lot of privacy issues around how somebody discloses and what that looks like. And you want to make sure you're being very cautious of that. So if you are addressing a behavior, for example, you're not doing that in a public forum. You're doing it in a very safe environment. How you react to someone as well, that's also done in a much more mindful way than how you would normally react to it. So I think there is a balance. You can't force somebody to disclose. You do want to make the environment available so that they do feel that they can disclose. There's many reasons that somebody wouldn't disclose. And a lot of that is, the reduction of how people think about mental health disorders, but also how we react to them.
So you answered this question partially, I think, earlier in the discussion, but what would accommodations for psychological health in the workplace look like? Could schedules or tasks be adjusted based on psychological wellness? Like, what would you recommend there?
There's so many different things, and there's actually a really great resource on it called from Workplace, I want to say Workplace Mental Health Strategies, and they have a whole guide on accommodations for mental health, and it's a free guide. So I strongly recommend taking a look at that. I can put it into the resource guide as well. But a lot of the accommodations, like Mark just said, is, is flexible work arrangements. How can we do separate tasks in different ways? How do we reallocate tasks? Do we take away some of the exposures? So if you have somebody working on like that cone situation, moving that task, changing it to a different time, changing it to a different date. There's a lot of different accommodations that can be made with somebody. Sometimes noise is something that affects somebody that is having a difficult time focusing. Are there, physical things that you can put in place to reduce some of that so it can help their focus? So I strongly suggest looking at that guide that I'm referring to, but there's like courses on strategies. It's a big topic.
Okay. Well, I'm gonna have to draw a close to the questions there. There's one, how do I look into the courses with opening minds? We're gonna send a link out to everybody that's on the webinar today, and there'll be links through our website as well. So that would be a way for someone to look into the courses on opening minds. I want to thank everyone for joining us today and asking questions. And thank you again, Tiana, for spending this time with us and sharing your insights. Watch your email for links to resources mentioned today, and you should receive them by the end of the week. For a replay of today's webinar, go to ACSA's YouTube channel, where you'll find the recording in a day or so. Finally, please everyone stay online on Slido and fill out our post-webinar survey, which will be available after this session. Our industry is grappling with real challenges in ensuring psychologically healthy and safe workplaces. However, you, the industry, and our partners are also actively working to prevent harm to our workers and promote employee wellness. Please keep the conversation going by joining us at our November 6th and 7th conference in Edmonton. We're putting together a program that builds on foundational safety and continues our pursuit of safety and business excellence. There will be plenty of networking opportunities as well. Learn more by visiting our website at youracsa.ca/conference. Thank you, everyone. Please stay safe, continue to look out for each other, and take care. I look forward to seeing you all soon. And thank you, Tiana.